Hello there, this is Gregor. I'm talking today about the histrionic personality disorder, HPD. Also, I draw some parallels with narcissism, narcissistic personality disorder, NPD, especially in the lights of our upcoming election, where one of our candidates is being diagnosed with narcissistic personality disorder and psychopathic behavior. So personality disorders are basically defined when people cannot really cope in the environment, in the social environment they are in, which can differ. Like certain disorders are being considered differently in India, for example, like in the United States, but also the the expectations and the impairment in their respective society can lead to very difficult lives and dysfunctions. Early diagnosis is quite crucial because it can make people functioning better and stabilize them and possibly even heal them if it's being caught in time. And so they can avoid their difficulties in their work life and their social life, especially personal relationships. Histrionic personal disorder is a disorder where the person who has it feels very uncomfortable if they're not in the center of the attention in a group or in their respective social setting. They're also a little bit dramatic. They're theatrical. I think the word comes from Greek, where kind of you put on a show kind of thing, like a theatrical behavior. And they are also often preoccupied with their physical appearance and how they dress, and they try to gain approval with this kind of attention-seeking behavior. So a person with a histrionic personality disorder, or HPD, um, becomes rather uncomfortable and difficult to bear if they are not in the center of attention and they're getting the constant approval. For this, they do anything. They can misbehave, so to speak, not to the expectations of a social norm, or they dress provocatively, or they become extremely flirtatious, um, often with women who have that HPD. So they often become seductive, and they have also inconsistent moods and emotions. So there's something off in them, and you realize, but it's all about them. So that's where it becomes uh, evident. What is also quite visible with them is they try to outperform people in social settings. If somebody says something, they have a better story or a bigger story to tell, or they always try to get back the word when they're speaking, getting the floor, getting the floor time, so to speak. And yeah, it defines their interpersonal interactions, which can be quite challenging for the company around them. So you can read the rest of the slide. I realize I need to leave some time for reading. Okay, now we can jump to the next one. The prevalence rates of HPD. Yeah, it's interesting. There are two different references. The one says 1.8%, the other one between 1 and 3%. And they're all from legit sources. Wonder how the discrepancy of 300% can occur in official um, prevalence rate studies. It affects more women than men, or at least so far there have been more women diagnosed with HPD. But since it's a relatively new um, element in the diagnostic manual, uh, I think there will be new findings made also with male. As I mentioned before, there's also a strong impact for cultural influence, and also socio-economic factors influence the prevalence rate of HPD. But you can see here also my little statistics. It's usually women have it, I would say, about 20 to 30% more than male. It's also interesting that since women are being more allowed to be emotional and expressing their emotions, and also they're seeking attention. I mean, is their sexual energy of women is the one which draws in the attention of the male. So in that sense, there's also this attention seeking going on, but that's more psychological and in a social setting. So that may be also why there are more women diagnosed with HPD than male. And I'm very curious how the future will show the new researches in the transgender studies, like female to male and male to female. That may be something for Robert Sapolsky. All right. So in this slide we have the difference between HPD and borderline BPD and narcissistic personality disorder NPD, and how they overlap. So they kind of have a lot of similar factors, yet they are somehow different. And one of the things with the narcissistic person, they have a sense of entitlement and they need to be the boss. They're kind of more bossy. Whereas the NPD is just kind of screaming for attention, but can be empathetic for other people's issues or problems. I'll give you a little bit of time reading through here. This is a nice collection and also a nice graphic which correlates the overlapping issues. But one of them is really to stay in the center of attention and being the shining star, so to speak. They all have that in common, which I relate. I mean, I personally, but I'm not just a student, related to the upbringing of certain people. Like Trump is an excellent example, where Fred Trump was the father of Donald Trump, was extremely not present in his son's upbringing, and he belittled him and made him look like a fool. And so the father was really harsh and horrible. And look what he brought out of little Donald. He's constantly trying to prove himself and feels like entitled that he owns the world and the presidency and what have you. Yeah, this goes more than often goes back to the parents. Now we're coming to the point of the treatment, what we can do with HPD. And yes, that is pretty much the same old formula as the CBT, cognitive behavioral therapy, with certain medication. The medication part is because this is closely linked to, I think 60%, or I have it somewhere, have other disorders, like anxiety disorders is the most common one with HPD. So when people have that, and that also leads often to substance abuse, of course. So the medication would be either SSRI uptake inhibitors or lithium for calming down the brain functions. Depends how severe it is, of course. But cognitive behavior therapy, which I'm a fan of, is good because it shows a mirror to these folks to see how they come across to others, which they may not see before. So I think CBT is very important. I hope you had a chance to read it, because I'm jumping now to the next slide. Psychotherapy for HPD. I just mentioned it. To improve the emotional regulations, interpersonal skills, and becoming more aware of self. I mean, we all need that, don't we? But in this case, particularly how we come across to others. Psychodynamic therapy. And then CBT, of course, have some subsections of different type of therapies. The therapist has to discuss it with the patient. So we're going to jump to the next slide, which will be this case study. A little case study I made up here. It's a 30-year-old woman. She's a sales executive. She's in the boardroom. Of course, she's young and sexy, and she dresses provocatively, even more sexy than she already is, and she's flirtatious. And yeah, it makes some of the colleagues, especially female colleagues, very annoyed. It creates a friction in the work environment. Whereas she's definitely a very successful salesperson, so she sells the heck out of anything with her flirtatious manners, and so she's successful, but she has a very empty life. She realizes she has nobody. She has the fat paycheck, but besides that, she has disastrous relationships. She's very promiscuous, tries with sex to find some meaningful relationship, but it doesn't work. So that's when she goes to a therapist, and they find out that she has HPD. All right, jump to the next slide. Similarities between HPD and NPD. You can see the little graph. They're attention seeking, they have superficial charm, they're emotionally volatile. That means they easily get hurt. I forgot to say that before. All of these personality disorders, they are very sensitive and not vain, but kind of vain. So like kind of they easily get hurt. So we have to be very careful with them. When you come across somebody who easily gets hurt, then that may be a sign for one of these personality disorders. Treatment for both involve self-awareness and improving on interpersonal skills. And that very often leads to successful relationships. And that's really what these people need, some stability, emotional stability. We're jumping to the next slide between the differences between HPD and NPD. Yeah, the attention seeking, and usually they only can be in kind of shallow relationships. I also forgot to say that NPD, the narcissistic personality disorder, manifesting grandiosity and entitlement, like self-entitlement, can be quite annoying. At least for me, and they always get the biggest piece of the pizza, or they're allowed to come late to a meeting, or they're just entitled for more than anybody else of us is, and that's not. How should I say? They don't have the self-entitlement issue. And makes them easier to bear than the NPD folks. But as you can see, if you enlarge the little graph I have, that shows the overlaps, what they have. They're standing out of the crowd. You always find them immediately. Can be sometimes mistaken as a natural leaders. You think they're ideal for leading a group or whatever, but after a little bit of looking deeper into it, you see that's all about them. It's not for the team. Yeah, they have really strong impacts on the relationship. Uh, as I mentioned before, they're kind of shallow and nothing deep, and they do not really find what they're looking for, loyalty or somebody who's there for them, somebody they can count on. Partially because themselves they are not like that. So, but they're seeking for it. It is, again, according to my intuition, it's something gone wrong in their childhood with their parents and their upbringing. But I hope you had enough time to read the slide and impact on relationship. Yeah, CBT helps a lot, cognitive behavioral therapy, and making them aware of their thought patterns, of their behavior, and also of what to expect from others based on what they put out. Okay, jump to the next slide, impact on daily life. That's a nice slide I found. It's something like, balancing, like we all need to balance in life. That slide shows specifically work and life, but I would say personal relationships and work is the strongest part. And they need to, to become aware of their issues, and that it's not as dramatic as it seems if they're not in the center of attention. I had to learn a little bit myself. I would have to say I had a tendency to be the center of attention, and it was based on a validation which I never got as a child or even my youth. But then with a lot of self-awareness and therapy, I got around these things. Okay, now we're coming to one of the last slides. Importance of seeking treatment, just what I said. Basically, getting along in life and finding harmony and happiness. But we can only do that with self-awareness, becoming aware how we come across to others. And it can be a painful path, especially at the beginning. But with a good therapist, we all can manage to do so. Medication, again, if this disorder is combined with another disorder, especially bipolar disorder, then of course medication is very, very important. Which brings us to the last slide, because it's about the support system. We can pull in family, friends, good therapist, and working on building awareness about the shortcomings. I'll let you read a little bit about that. And the last slide will be just the references where I got my numbers and the information from. And I can send that to you. I will tell you in a second. Okay, I hope you had enough time to read it, because we're jumping to the last slide. Here we go. Here's the good old references and everything. So if you're interested, I can mail you this presentation. You can reach me at Gregor Reti, GregorReti @gmail.com. I hope you learned a little bit about that. HPD. Thank you for your attention. Bye-bye.